Thank you, Wenjing. We'll try to come back to the issue of governance again towards the end. I think we heard in the first session how important governance is. But let's get on to some nitty-gritty issues. So we have had the two pandemics in the past 20 years, the H1N1 pandemic and COVID-19, and many other epidemics in between, initiated by spillover from animal viruses to humans, SARS, MERS, Ebola, etc. So looking to the future, what keeps you awake at night? Leaving aside COVID, of course, which is keeping all of us awake, I guess. But what spillover of an animal pathogen is of greatest concern to you? And maybe again, James?
Malik, that's a really good question. And I think I'd rather not share with the panel what really keeps me awake at night. But what I worry most about is the fact that there is so much spillover going on into the human population all the time, and we are not finding it. We are not seeing it unless there is transmission between humans. And I think the best example that I can give you there is the very well recognized and much feared disease Ebola, where a colleague of mine, Emma Glennon, published in a PLOS journal 2 years ago, the fact that we are missing more than half Ebola spillover events. It's very clear from the distribution of outbreak sizes. We would expect to see far more small ones. We only see them even in areas where there is heightened surveillance compared to the majority of the world. We only see them where there's substantial transmission. And that, for me, is the big worry. This is a disease that is so well characterized, so well known, and so feared, and we're missing them. And that's what I worry about. It's not some amazing new virus with a name that no one's yet invented that's going to come around and kill us all, which of course something might. It's the fact that we have a number of infections going on and we can't even find the ones that we know a lot about already. And that reflects what for me is the biggest gap in this whole system. And that relates to surveillance on the ground in many low and middle income countries, particularly low income countries in the tropics, where there's not adequate resource to find infections which we know are there. Thank you.
Yeah, Richard, do you sleep well or anything keeping you awake?
It depends on the day, Malik. But yeah, so from my perspective, yeah, and I've got to say up front, I'm coming at this from nowhere near an impartial sort of perspective. But I think clearly it's the viruses, and I know we're going to come to this later, but in sort of an absence of a real ability to accurately assess risk of a lot of these viruses, we have to go back and look at, okay, who's done it before, and so we have a couple of candidates. You told us we couldn't pick the coronaviruses, but clearly we can't ignore them. And flu, and to me, it's, flu still has to be at the top of the pile of these potentially pandemic threats. We know they happen. We know they happen, in comparison to anything else frequently. And I think what perhaps even keeps flu keeping me from sleeping where even the coronaviruses don't so much is their ability to change once they do get into humans. So again, looking back at history, what viruses have come in, and then once they're in, what viruses have continued to cause problems year upon year upon year. And again, every time I do these own little thought experiments in my mind, again, it's flu that floats to the top every time. So yeah, it's when I can't get to sleep, often it's nothing to do with pandemic preparedness, Malik, but when it is, it's the flu that does it for me.
Yeah, Wenjing, I won't ask you about sleep patterns, but so the point was made about surveillance and the need for situational awareness. I think James pointed out there's much more spillovers taking place than we even know, even with lethal disease like Ebola, and Richard was talking about flu and of course coronaviruses and other things maybe. I mean, paramyxoviruses, etc., could be future threats. But one of your main tasks, Wenjing, is surveillance for human as well as for animal flu. So how do we enhance surveillance in animals? I know your main focus is in flu, but you're of course also responsible for the zoonotic strain selection for pandemic vaccine, pre-pandemic vaccine preparedness, etc. So can you comment on surveillance? And of course, I'll go back to Richard and James on that as well.
Yes, so surveillance, exactly as you said, Malik, is that for WHO, our main primary focus, of course, is public health. So surveillance in human populations through the global network is what we've been doing. But surveillance in animals is officially under OIE-FAO from the veterinary side. What is important is the interconnection, and this is why, again, One Health, or concept here, is a human-animal interface, surveillance. So every year we have routine meetings twice a year, bring together those partners together to review the recent data. But ad hocly, also, if there is anything unusual took place, we'll convey calls immediately with OIE-FAO, with the countries in question within outbreak, as well as collaborating centers, including like Richard, to have risk assessment of those. So this is what has been doing for many years. I think we're coming back to original question you are asking about our concerns. So my concern is not only for future or about pandemic, but even now. We know that influenza activity has been low for since last year, since the COVID pandemic. It's been low, but it is still circulating. I mean, seasonal influenza virus is still circulating. We know it's circulating. And if we look at the zoonotic virus detection, it's the same. It's the same as same period of previous years, where we still have lower detection of H9N2, H5, even H5N8 was the first time reported from Russia. So this is really good concern, not only for future, and also now. We are really preparing an unusual flu season. It may not be a pandemic, but it might be a severe epidemic. And it is equally of my concern. So if it was something really disturb my sleep, or actually this is type of unusual, atypical influenza season at any moment now, this is something really of my concern. Back to you.
Yes, I mean, certainly in the midst of all these challenges, we can do without an atypical severe influenza season. But Richard, so coming back to surveillance, and also Wenjing also pointed out the issue of risk assessment. And there's also another challenge, Richard, as you know, that many of the influenza or other viruses that pose risks to human health may not necessarily cause disease in animals, so that the normal veterinary surveillance may not necessarily pick up, threats to human health. And then also the question of risk assessment. So Richard, can you address those?
Yes. So yeah, of course, as usual, Mal, you're sort of dead right there. Right? So the surveillance for some of these, again, if we're going to talk specifically about influenza as an example here, in the agricultural sector varies a lot. So these so-called reportable disease, so OIE reportable diseases in the context of flu, that is the highly pathogenic H5, H7. So, there is a requirement for member states with an OIE to actually report those diseases. So from at least a global perspective, there's some idea of at least where those outbreaks are occurring in poultry populations. Of course, that information isn't always entirely accurate or sort of covers the whole story, but there's some information. But again, these other low pathogenic strains that, again, cause probably just as many zoonotic infections, most, again, probably undetected, like the H9N2s. Again, there is no sort of international mandate to report those infections. So I think when we're talking about those two things, those reportable events, there is information that comes in through sort of the international national organizations. With some of these other ones that don't cause the disease, I think a lot of the information comes much more from the academic sector. Again, so these small, more typically small type studies where people have a research objective, go into some of these environments. For some of those less impactful from the animal side viruses, again, it's that situation where a lot of the information comes from. And again, this all also comes down to the fact of, how do you do surveillance for each of these types of viruses in the different host populations? And there is no one answer to that, because it is a different thing, I think, that drives surveillance for even different flu viruses in the same population. And again, so you can also extend that to swine influenza, for example, which, again, typically in the industry doesn't cause a lot of mortality, but certainly some morbidity, no requirements to report. So again, a lot of the information on swine influenza, again, comes from that more academic type project. I think you asked me to move on a little bit to risk assessment of all these different viruses, Malik, and to me, that is probably the area where I feel that we're least developed sort of as a pandemic preparedness community. We can clearly go out, we can find these viruses all over the place, with the sequencing technology, there's now over 1 million SARS-CoV-2 genomes in the databases, so that side of thing is rolling along well. What is really lagging is the technology to do the real assessment of risk of these viruses. And that's not something you can do from just going out and collecting a sample and sequencing it. We have to have these basic laboratory characterization of these viruses to understand, what is it that causes a disease? What is it that allows them to jump from one host to the other? And unfortunately, those are much more difficult studies to do. The throughput is far lower. The amount of facilities globally to do them is less as well. So, again, coming at this from a point of limited resources, we can't prepare against them all. We have to do some sort of comparative risk assessment. To me, that's an area that we need to put far more resources into. Over. I think you're muted there, Malik.
Right. So, James, the same question to you, particularly about the risk assessment, because surveillance is one thing, but also another question to you, because as Richard was pointing out, a lot of the viruses that are of relevance to human health may not be of interest to veterinarians per se. And indeed, finding them may be a major trouble for them. It will be affecting their livelihoods, certainly of the farmers and the chicken farmers or the pig husbandry people or whatever it is. So how do we deal with that issue? And then the question of risk assessment, you're working with vets in Africa. How do you risk assess what you find? James?
Thank you. These questions are getting harder as we go through, Malik. And this is a really challenging one. And my fellow panel speakers have just described how challenging risk assessment can be. And I think prediction is even harder. I believe, and I'm very happy to be corrected, that we cannot yet predict the next virus, the next influenza virus, the next seasonal one. All of our judgments are based on what is currently circulating as being, but we don't know where the virus will go to next. So given all of the resource that goes into the characterization of seasonal influenza viruses in humans, my feeling is that we are a very long way from having an accurate ability to assess what poses the next pandemic threat. Having said that, I think it's absolutely clear, as Richard has just described, that we can risk assess and prioritize different infections as being much more likely to transmit. And Malik, in various introductory questions and statements, you've pointed out the coronaviruses, the influenza viruses, and the paramyxo viruses are probably the most likely, based on our understanding of their ecology, their ability to transmit between species, and history as well, where we've seen these things arise. I think that's really important. If we're talking about formal surveillance programs, it's very clear why you would set up a human surveillance program, and that is to detect diseases which are important in humans. If you look at the objectives of veterinary surveillance programs, typically, as you've hinted at, they are to detect important diseases of animals. And the challenge, as you've articulated, is that many of these infections that pose pandemic risk do not cause disease in animals. Now, that's true in both wildlife and in farmed species. The best characterized, the best known, although quite neglected, example of this is Campylobacter of poultry, the major global cause of food poisoning. Causes no disease in chickens whatsoever, even with a prevalence of infection of up to 100% in intensively managed flocks. I think the pandemic that we will really be worrying about in 20 years' time will be antimicrobial resistance. And the surveillance for that in animals is particularly challenging because so often the infections that we're concerned about, it's not the infections we're concerned about, it's the specific genes that can be transferable between bacteria that may be found in common species like E. coli, found in every animal species, every farmed animal species. And until we reset very clearly and openly what the objectives of surveillance are in different species, humans and other animals, then I think we will be facing these challenges where outside of a One Health framework, people will justifiably be asking, well, why aren't you vets finding these infections that are posing risks to us as humans? And actually, we may have very good veterinary surveillance activities, but they're about finding disease in animals, not about finding infections in animals that may subsequently pose a risk for human health. And until we have these joined up conversations in a One Health framework to decide and then to put resources behind surveillance in animals, I think that we're going to be facing the same challenges that you've articulated. And at the moment, I don't see these conversations moving forward as fast as they should. Wei-Jing mentioned the governance of surveillance and around animal infections being a separate international body, the World Organization for Animal Health, OIE. At the moment, notifiable OIE diseases are almost invariably those that are significant infections in animals. And until we can start having, bringing the conversation together around the same table to think about what we really need in terms of international surveillance programs, we're going to continue to stutter between medical surveillance and animal surveillance without properly integrating it in a way that is essential, in my belief, for us to do all that we can to try and prepare and prevent the next pandemic. Thank you. Malik, you're mute again, sorry.
We'll come back to the questions of governance and financing again before we close, hopefully. So keep some of those thoughts in mind. But as you pointed out, it may be quite difficult to anticipate, sometimes even to risk assess what may be coming next. So, James, are there generic upstream interventions in terms of managing wildlife, in terms of managing the trading practices in the animal husbandry systems, etc., that can reduce the risk of these emergences, even though we may not know exactly what will be the particular virus that may cause a threat? James?
Malik, thank you. And that's such an important question. And of course, the approaches will be different depending on the different system we're thinking about, whether it's a farmed poultry system, an intensively farmed poultry system, or more of a backyard approach to farming. I think that biosecurity should be at the heart of our pandemic prevention practices when we're talking about diseases coming from agricultural animals. Biosecurity is essential for trying to prevent large outbreaks of disease occurring, or even outbreaks of silent infection, of asymptomatic infections in animals, if we have good biosecurity, then those are less likely, just as an overt disease is less likely to occur, because if you stop mixing between groups of animals and do all the things that seem so novel in public health medicine over the last 12 months that we've been introducing as our response to the pandemic, but actually in the veterinary profession and in animal management, we've been doing them for decades because we don't have the same societal challenges to implementing them. So these basic biosecurity approaches are immensely important in relation to preventing animal infections, which therefore prevents animal infections spreading to humans. I'd like to draw a distinction, though, with wildlife infections. I think the massive international trade in live wildlife is a huge threat, and I think we must do all that we can to try and prevent it. And that live trade can be from farms that are farming wildlife, and I think that is my understanding is that is the origin of the emergence of SARS in 2002-2003, coming from farmed palm civets. Now, I think that's really important. And if these palm civets had been traded to be eaten in a dead state, we would not have seen the same problems. And it is the trade, the regional and international trade in living animals, which does pose particular risks of transmission. I'd like to make one final point around mitigating risk factors in a non-regulatory way. One of the greatest risk factors for populations suffering from zoonotic diseases is poverty. It's livelihoods, restrictions that force people and animals to live close together. There are cultural issues as well, but one of the major drivers is poverty. And I think this is where I feel that if we want to do more to generically prevent pandemics emerging, then alleviation of poverty and locally driven and locally owned development programs are of fundamental importance. It's not just about altruistic. I think there's direct benefit for all humanity if we can enhance development in a sustainable way. Thank you.
Malik,
thank you. Yeah, Richard. Yeah, sure.
Actually, I'm going to do something I have no power to do at all. But I'd actually like to throw that one back at you, because at least in my mind, some of the most, at least to me, impressive sort of interventions in this area has been what's gone on in Hong Kong and sort of the market since 1997. What do you feel in terms? I know there's been a lot of things that were implemented based on surveillance that was going on, based on the science behind that surveillance. What in terms of what that's done for the bird and the live poultry markets in Hong Kong over time? What were the most critical interventions that were done in that environment?
Well, I'm not really sure whether you have the power to question the moderator, but I will.
I said I had no power to do it.
Yeah, so I think, so with influenza, with certainly influenza in poultry, we have learned a lot about the risk interfaces and how we can reduce these risks to humans. So clearly, in the case of avian influenza like H5N1 and H7N9, it's the live poultry markets. So in Hong Kong, for example, we introduced a series of interventions short of completely closing poultry markets, which of course makes sense, but there were cultural issues that prevented that completely being implemented in Hong Kong. But using rest days to break the amplification of the viruses and making sure that poultry are sold during the day and the retail market is empty during the evening, that again, demonstrably, we could demonstrate that it dramatically reduced virus amplification in these markets. And then we also know from understanding the evolution of viruses like H5N1 and H7N9 that these viruses are put together by the mixing of viruses from wild birds coming through wild ducks and domestic ducks on the one hand. So that's one marketing system of aquatic birds. And on the other hand, reassorting with viruses in chickens like H9N2 for example. And in theory, separating those two marketing chains could also have quite significant impact in reducing risk. I mean, that has been achieved in Hong Kong, but it may be more challenging to implement it across Asia. But I think these are examples of interventions that we can put into place without knowing which virus may be the next influenza pandemic, but which will reduce the risk of these viruses emerging, both at the zoonotic level and at the pandemic level. So, yeah, and I think some of the other measures that James mentioned about the wild game animal markets and other risks like that as well. So I think I would like to move now to the question of governance and financing. I think Mike Ryan said in the opening session that the key thing to addressing these issues of epidemics is governance, governance, and governance. So we talked about governance issues in One Health, but also how we deal with reducing risk in these manners. And then we also talked about the importance of surveillance. And as James said, there is funding for surveillance for animal diseases, but there is no funding for surveillance in animals for infections that do not cause disease in animals. So maybe I go back to James, maybe, and ask him what he can suggest about improving governance and also funding to carry out these surveillance activities that I think are important.
Thank you, Malika. And that is a key question. I think that governance is restricted by finance. Governance is much easier if you're not financially restricted. If you know you have a task to do, and you know that you have the funds to do it, then you can set up a system that you can, if willing is there, set up a system that is appropriate for the objectives of that program. The reason I raise money, and I'm going to use an example, not of a disease that poses pandemic risk, but one of the best known zoonotic diseases that exists, and that is rabies. And I want to talk about rabies in humans. Around 60,000 people a year die of rabies. Nearly over 99% of them die of rabies contracted from a dog bite. There are many countries which put large investment into post-exposure prophylaxis in humans to treat people after dog bites. As a generalization, and I recognize that every generalization is wrong, the budget required to vaccinate regularly all the dogs in those countries is rather less, substantially less, than the PEP costs for the Department of Health. But those departments of health typically cannot spend their budgets on vaccinating dogs because that's the responsibility, well, I was going to say of the Department of Agriculture, but actually dogs and probably wildlife as well often fall outside of the remit of departments of agriculture or food because they are meant to be restricted to agricultural animals. And so you have a system where you don't have an approach based on a traditional division of governance that can be cost effective in terms of delivering optimal preventive care. And I think that exactly the same problems exist around surveillance of animal disease. We have all of the technology, we have all of the professional skills able to do these things, but we don't have the resources to do them. And this, for me, is where we should be thinking about surveillance of human infectious diseases in a One Health concept, under a One Health umbrella. If we're concerned about surveillance and early detection of human disease, then we should be thinking about not just those things that are present at a medical clinic, but we should be thinking about threats and where they might come from, and think in a One Health concept about joining up our surveillance activities of these, in contrast to surveillance, obviously, for established human infections, which have their own very clearly established methods and approaches. But until we start actually thinking at a fundamental level at what we are trying to deliver in terms of our surveillance programs, we're going to be going on having these conversations for another 10, 20, 30, 40 years. And this is an opportunity. I think this pandemic presents us with a real opportunity to change the way that we think about surveillance in terms of objectives and what partners we need in order to best deliver those objectives. And I do believe that the partners should be collected under a One Health umbrella and should include those responsible and able to deliver animal surveillance, just as in the same room as those who are delivering primary human healthcare related surveillance. I hope that answers at least part of your question, Malik.
Yeah, thank you, James. So, Richard, again, I mean, who funds surveillance? At the animal level, at the animal-human interface level, because this is where things sort of fall between stools. I mean, I know you yourself, Richard, have been fortunate in securing funding, but it is quite a problem, right?
Yeah, no, absolutely. And I sort of give the props to NIAID, and at least in the US, who some 14 years ago now, I think, realized that certainly as a I'm going to come at this from the point of an academic doing sort of basic research rather than someone at sort of the level of national agency, but it was near impossible to get funding to do this type of surveillance at the human-animal interface. Going through these typical academic type study sections, it sort of didn't strike them. It was important, yes, but often innovation wasn't terribly high, et cetera, et cetera. So certainly from in the US perspective, again, from coming at it from the human health side, I had put in place these SEERS network specifically to fund some of this surveillance activities that, again, wouldn't have probably been funded through at least their mechanisms otherwise. I think the other way I think we need to think about it, with these limited funds, and it kind of touched on a little bit, but from the One Health perspective, and James talked about this, that there might be different goals from surveillance from an animal health perspective, a human health perspective. Take, for example, swine influenza, I think is a good one here. So again, it's something that certainly problematic for humans as a zoonotic threat from the swine industry. Yes, it causes some problems, but it's not their major. Again, often what is a major for them is respiratory distress syndrome, right? So again, it's not necessarily a pathogen-specific event that causes them problems, but it could be flu, it could be PRRS, it could be some of the other respiratory viruses. And often coming at this from this point of limited funding for surveillance, I think that's where maybe we need to start thinking a little bit more. As essentially it's the same sample. So as me as a flu researcher, I want that swab to look for influenza. But potentially those more from the agricultural side want to look at PRRS virus within that sample. So I think there is more we can do from this One Health approach even. This is not answering your question, Malik, but when there is these limited resources, trying to make the most of what is out there again, so that both sides get the information they need from doing it together. I think Wenjing can talk more about, I think, the funding for this type of thing from a sort of international perspective, but there's no doubt funding for these types of things is very challenging, and there's not a lot of avenues, not a lot of resources to actually get these things funded.
Wenjing, so I know, of course, that the WHO is always short of funds, but at least from the advocacy point of view, maybe can you comment on, how you can drive advocacy for this type of surveillance, which basically falls between all stools? Wenjing?
Exactly, Malik. As you said, that the WHO is not a funding agency, and well, yes, you're right. It's call for money, indeed. So you asked about surveillance. So any surveillance, in order to be sustainable and long term, it would have to be owned by a country. I think this is pretty clear from what we have learned from the influenza surveillance in the past more than half a century. Anything like a project, a research project from external, it can generate good results, but it is always very difficult to sustain for a long time. So I think if there are additional funds available, it could be financed through One Health, for example, but still need to go to the country. And the key point is to be owned by the country. This is really the key, in my view, in order to be successful. And you also asked actually about the governance side. But before we talk about the governance, one thing even more important actually is mentioned by James in the earlier intervention is about social development, the system development. It's beyond this. I visited a country. Of course, it's to investigate any influenza outbreak. The people were very poor, so they had to buy the dead poultry from the market. We visited a village. In the village, the feces of the poultry were on the street of the village. There were children play around, and their dead animal bodies in the river of the village, and the whole village, there was no running water. So this basically is a fundamental issue before we are talking about governance itself. But after that, when we are talking about the governance, it is true, we need to organize the work, especially the work of the global impact, globally coordinated, and there need to be some governance in place. For example, from human side, we have the international health regulation in place. From the global surveillance network, although it's not so legally governance per se, but we did organize in a way, in a standardized way, with a buy-in from the country. I think from the animal side, one thing mentioned also by Richard is that also notifiable diseases, those low pass like H9N2 is not notifiable diseases from the FAO or OIE side, but from human public health side is of particular interest. We always received reports from zoonotic infection in human by H9N2, but we know very little about what's happening in the poultry population because it's not notifiable diseases. So I think if the question is about what any gap or anything need to be developed under One Health umbrella is to develop this common ground. What exactly the joint objective? Human health, we have objective. Animal health, there's also its own objective, as well as environmental health. It's also what are the joint objectives of this One Health, and then have the financing mechanism were in place. So I think, as I said, that governance is very helpful to get the work done. But in order to get it done in a systematic way, in a quality way, to develop this trust, this confidence, from the participants. So they only know how to do, but they also know why they are doing so. What is the benefit in doing so? And if there's impact on the economy side, there's certain mechanism in place that they would not be hesitate in doing so, then I think it will be very successful.
Thank you, Wenjing. We are getting close to the end of our time, but I'm going to go around each of you asking. We discussed many things, but I'd like you to think about one or two major priorities that you think, from the issues and the challenges that we face. But before I do that, Wenjing, I have another question for you, and that is about data sharing. So I think the influenza program is actually a fantastic example of data sharing, but even that has had its challenges. What I mean is the virus data sharing, sequence data sharing, and now even, for example, with some of the Nagoya and other protocols are bringing challenges to data sharing, even for the influenza program. So can you comment on that?
Yes, I think we have a lot of experience from influenza side about data sharing and virus sharing. I think one of the advantages certainly is that the global mechanism was established more than half a century ago. And at that time, I think people were thinking in a different way as we are thinking now. At that time, people may not think that when I contribute something, I need something in return and need to be as a rapid return. So if that's the case, of course, they need to have the governance structure, this access and benefit sharing mechanism, these legal binding terms in place. But at that time, the world maybe was still not in that era yet, which enables the establishment of a highly functioning system globally with regards to sharing of surveillance data, sharing of viruses with the goal of risk assessment and develop the best possible candidate vaccine viruses. But in recent years, there are a lot of new developments nowadays. So it did add were challenges, but of course, always challenges comes with opportunities, we all know. But for influenza, it did comes with the challenges. Well, the latest example is that this year in February, we select a candidate virus from a country. But that country, although they are Nagoya party, but they don't have the ABS legislation in place. So basically, even now, there's no clarity whether that virus selected can be used for the influenza vaccine production or not. So we did facing this type of issues. But I think we also have very successful examples that may be useful for other pathogens. For example, the genetic sequence data sharing. In 2009, 2010, about the sharing of genetic sequence data of the highly pathogenic H5N1, some countries were reluctant because after they shared the viruses, they find out actually they need to, for example, spend money to buy vaccines, or they didn't own this technology in the country. So because of that, a mechanism called GISET was established at that time, and it's still been functioning pretty well. In the COVID pandemic, this platform was used since day one, actually, since last year, for the genetic sequence data of SARS-CoV-2 were sharing. So I think why it is being acceptable by countries, because it has a data agreement, the ownership of the data still belong to the country. So country has the confidence in put their data in the platform to be used by the third parties. But I think the sharing, Nagoya Protocol is an area, I think a lot of people working on this. And I just hope that when people addressing the issue of Nagoya Protocol and ABS system, people would be able to think to take the priority of the most immediate needs of public health as a priority while addressing this issue for long term.
Thank you, Andrew. So in the last few minutes, I'll just go around, starting with James. What are the, if you had a wish list of one or two things, what would they be? What are the points you would highlight from our discussion and the broader issue? James?
Before I I'd like to make one comment on data sharing. And I think that data sharing is much easier for people in privileged positions like me working in the University of Cambridge than it is for my collaborators in the University of Ghana with a relative lack of resources. And I think that we do need to address that issue around data sharing before it's going to work properly, because I don't think, I'm not disagreeing with anything that Weijing has just said, but I do think that there are, it is much easier to do this from a position of privilege. In relation to those things which I'd really like to draw our attention to, I'd like us actually properly to deliver One Health frameworks for surveillance, where we don't see One Health as just being the intersection of human health, animal health, and environmental health, but we actually think about What are the threats that we are most concerned about, and how do we best address them? And think about it there, rather than a really reductionist subset of the things that we care about within our own specific disciplines. And I think that actually, if we think about disease in that respect, we have a far greater chance of trying to deliver a proper One Health program, which should help reduce pandemic risk far more than we're delivering at the moment. It's not just those infections that cause disease in animals and so on. And this is repeating what has just been said. We have to think much more about what we're trying to deliver through our programs of prevention. And that will mean that we need to work together across these three very broad areas. Each one is very broad in itself. And through that thinking, then I think we can start thinking holistically about trying to deliver controls. And these controls are not just about public health intervention. They're also about how we farm animals. All those things that you were describing, Malik, as interventions in Hong Kong, which have been so successful in terms of reducing transmission and impact of influenza, things that we need to think, it's an approach that we need to take for systems that we don't fully understand around pandemics arising perhaps in many rural parts of the tropics. And we need to think much more holistically together rather than in this reductionist way that has so characterized many of our different professions up till now. Thank you.
Thanks, James. Richard and Benjing, 1 minute each. I'm afraid we're almost at time. Richard?
Okay, so two things, I think, Malik. One is, surveillance is clearly the key to this, but again, we can't forget, if we don't fully characterize what comes out of that surveillance, again, from a virologic perspective, we're leaving a lot of stuff on the table. I think the other thing, and I don't typically think about governance a whole lot here, but I was intrigued by the discussions around this on the panel here. And I have never met anyone who said One Health is a bad idea, yet it is the struggle to get going. And maybe that's because we are coming at it from a governance that we're used to, where, yes, we're in the silos, we think it's a great idea, but we all, within those silos, come at it with our own biases and interests, which will never change. So maybe it is time to think about a completely governance structure for managing One Health.
Yeah, part of it is the funding. I mean, the funding for different areas comes from different sources. So, Benjing, what's your wish? If you had one wish.
Yes. So just to put that in a simple way is that we need to, while we're talking about the future unknown pandemic, it is important that we start doing those we know that influenza, there is a pandemic threat, and we really need to build on that with experience learned from COVID pandemic, etc. And another, it's not a wish list, it's we already started. We're building the GISRIS, this influenza surveillance system into GISRIS Plus, which means a system that will be handling influenza and other respiratory viruses under One Health, like GISRIS Plus. If we could also see flu is flu, also for influenza. If there could be something like flu Plus or something similar under this umbrella, I think it would be very helpful. Thank you.
Okay, thank you. So thanks so much to the panel for a great discussion. And I believe some of this discussion will continue with one of the breakout sessions, which James will indeed be taking part in. So thank you to each of you. And in closing, I also have, in addition to thanking you and the people listening in, just to make an announcement that we will now take a short break of 5 minutes, I believe. And when you return, you will have 3 options for joining 3 different breakout sessions. One is on data sharing and transparency, the second on human and animal health surveillance, and the third one on finance and equity. So you can refer to the agenda for more details as to who's speaking, and to select your breakout room, you just click the button below the live stream, and there will be 3 options for you to select. There will be a slide put up during the break as well. So thank you again, and we'll look forward to meeting on the other side of the break. Thank you.